Good morning. We'll call the Board of Health Town of Shrewsbury meeting to order. Today is November 20th. It is 8:05 a.m. Minutes of the last meeting from October 16th, 2024 were attached to our packets. Are there any corrections or amendments? If not, I will entertain a motion to accept them as written.
Second.
Thank you. Ms. Walker?
Aye.
Ms. Rosacci?
Aye.
Abraham votes aye, so the minutes are unanimously approved. A review and of the diseases and communicable disease update. Ms. Houghton?
Thank you. Good morning, everyone. I'll go ahead.
Go ahead.
Okay. So this is just the nursing update from the health department. So in terms of communicable diseases, COVID cases, slightly down in October versus September, and this is reported cases, of course. According to the latest wastewater data, it looks like the cases are starting to go up again. And this is that time of year when people just hang out indoors more, and holidays are coming, so they're going to congregate. Flu, we've had 2 reported cases in children and 2 pertussis, no measles reported, no outbreaks reported.
Thank you.
And of course, per
In a call with 4 other people.
Of course, per MDPH and the CDC, it is still recommended that to prevent respiratory infections, it's best to mask and vaccinate as recommended, and as recommended by your provider. Nationally, there are a couple of outbreaks to mention. There's an E. coli outbreak from onions from McDonald's. This began in October. It's still ongoing with the investigation. Currently, there are 104 cases nationwide, but none in Massachusetts so far. And there's also an E. coli outbreak from carrots, and this is a multi-state outbreak. Carrots from organic whole carrots, bagged carrots from Grimway Farms. Currently 39 cases nationwide, 4 are in Massachusetts. Okay, and just globally, because this is ongoing right now, there's an international outbreak of Marburg virus. As of November 11, Rwanda has recorded 66 illnesses and 15 deaths from Marburg virus. And Marburg is interesting. It's rare, but it's severe. It's like Ebola, a viral hemorrhagic fever, and it causes serious illness and death. So most people infected are health workers, particularly those who work in intensive care units. Currently, no cases of Marburg related to this outbreak have been reported outside of the country of Rwanda. And that means right now the risk of infection for this virus to the United States is pretty low. And up and coming, next month there is a Shrewsbury High School health fair. And the nursing team will be presenting health-related information to the students as requested by the school. And that's it for our nursing report. Thank you.
Great, thank you. Any questions for Ms. Houghton?
No questions.
As far as the E. coli outbreak with the carrots, were those any stores in Shrewsbury where those were being supplied that we know of?
No, would you know that?
Not that I know of offhand. So when they're up for whenever anybody's up for their inspection, and there is an E. coli or any sort of foodborne illness outbreak, I do have the communications with them. If they have the product, what are they doing? If they've been in contact with the supplier to remove them off the shelf, or those sorts of things. So as I go to them, I'll add it to the list of conversations to have with them.
Awesome, thank you. No further questions.
Great,
Thank you.
thank you. Thank you, Ms. Houghton. Discussing updates from the Central Mass Regional Public Health Alliance, Mr. Dennis.
Good morning, Mr. Chairman. My apology, I couldn't log in, so I will ask my colleague, Ms. Emma, to give an update.
Good morning. So since our last meeting, we've conducted 31 total inspections, which is a little bit lower than average, but we do have upwards of 15 to 20 new establishments that are coming into town. So I'm working with them, making sure that all their paperwork and policies are in line, and ready to go, and reviewing all of their health plan reviews. We did receive 2 general complaints at restaurants. When the buildings department does their annual inspection, they saw some things that caught their attention that I went to go look at. One being some stagnant water in the kitchen at IHOP. They had a leak, a drain clog that they resolved that same day. I asked them to do some extra sanitary measures and get rid of the standing water. And then in KFC was the other complaint. They are having an issue with their freezer. They've been actively working on it since I brought this to their attention, so we're going back and forth, making sure that we get the appropriate solution in place to eliminate that issue.
Great, thank you. Questions for Ms. Stefanski?
No.
Great, thank you very much. We'll review our meeting schedule. Our next meeting is scheduled for...
If
Good
I
morning.
may, Mr. Chair.
Mr. Dennis, please.
Yes, so I would like to introduce Mr. Kyle O'Connor, who is in the room joining you guys. Mr. O'Connor is the new tobacco compliance coordinator for the Alliance Town. And he's present today.
Wonderful. Welcome.
Welcome.
Thank you for being
Welcome,
here.
thank you for being
Yes.
here.
Thank you, Mr. Dennis.
You're welcome, Mr.
Anything else that...
Yes. Also, I just want to let the Board of Health member inform them that this Friday we'll be having an open house from 9:30 to 11:30 for town staff. And the goal of the open house is share some of the initiatives that we have been working with in the town, but also just discuss with and work with town staff around addressing and enhancing our public health services in the town.
Great, wonderful. And to clarify, this is only for town staff, correct?
Yes.
Okay, thank you.
Welcome.
All right, our next meeting is on, Ms. Stockwell, please remind us.
December 11th,
Le-
which is a Wednesday at 8 a.m.
8 a.m.
in the Board of Selectmen's room.
Great, wonderful. Any other agenda items anybody wants to bring up?
Nope,
Hearing
nothing.
that, a motion to adjourn?
Second.
Okay, Ms. Walker,
Aye.
Ms. Rosachi,
Aye.
Abraham votes aye, the meeting is adjourned.
Thank you.
Thank you.